Hey guys, my name is Dr. David, and in this video we're going over 10 must-do exercises if you're experiencing knee pain. Our channel is fully about getting you out of pain, getting your mobility better, getting more strength, and having you move better. If those are things that interest you and you have not yet subscribed, please hit that subscribe button down below. When it comes to talking about the knee, there are really only three major things that can go wrong with it. Major thing number one is having problems bending the knee. Now that can be due to meniscal tears, post-surgical issues, arthritic changes. Typically those are the reasons you would have difficulty bending the knee, or if there's any swelling or fluid in the knee capsule. The other thing that can go wrong with it is the ability to straighten the knee. So a lot of pain with pushing the knee down or straightening the knee and losing some range of motion in the knee. We see that a lot with age-related arthritic changes. The third thing that can typically go wrong with the knee is that you have full range of motion, so you're able to fully bend it and fully straighten it, but there's pain. In this video, we're going to go through each of those three categories and give you some exercises to work with. Now, just a disclaimer, when we're talking about exercises to get out of pain, there are other things to do besides exercises. There is heat and ice, there are injections, there are soft tissue techniques to do, but by far the most research that's been done on any of the body when it comes to getting out of pain is exercise, and those have the best results. And so it's not the only thing you need to do to get out of pain, but it's probably the best thing. So we're going to work on the first category of knee bending first. So the first and probably best exercise to start off with when you're just having trouble bending the knee, it's painful at a certain point, is we're going to grab a long towel, roll it up. You could also use a belt, and we're going to put it right over here, top of the foot, and then you're going to go onto your back. Once you're on your back, what you're going to do is you're going to use your hands to help slide the heel all the way up until you get into that point of discomfort. Once you hit that point, don't push through it, but just sit there for about 5 to 10 seconds and then let it go. Try to have your hands doing most of the work. And so what we're going to do is we're just teaching the body that it's okay to go into these ranges of motion. And then back down. Typically about 10-second holds once you get to that painful barrier, 10 times. And typically you'll actually see about 10 or 20 degrees of increased range of motion after you've done this exercise. Pretty cool way to do that same exercise I just showed is to actually come right next to a wall and then have your knees up like this into the wall. And so let's say my right knee is the one that's painful as I bend it. I can actually just use gravity to help me slide it down the wall and just use the other foot to assist and control it. And just go all the way down, same idea, right till that painful barrier, hold it for about 5 to 10 seconds, and then I'll use my left leg to bring it back up. And then again, just like gravity, slide it right down. And then I can even give some overpressure if I want. If it's really further down, just that little bit of range of motion, and then help slide it back up. Another great exercise to do if you have pain and stiffness when bending the knee is what's called the bicycle exercise. And what that is I'm just going to turn to the side here. You're going to simulate riding a bike. And so up like that and back down. Great for knee stiffness. Just pretend you're riding a bike. Now if you have a stationary bike, that's another really good thing to use. But if you don't, this is an excellent exercise just to get the knee loose and get some more fluid coming in and out of it. And this should improve your knee range of motion as well. We're now going to move into category number 2, which is difficulty straightening out the knee and lack of range of motion with full knee extension. Typically, maybe 80–90% of the time, this is with people who have osteoarthritis in their knee, where there's chronic buildup of calcium deposits and fluid in the knee, which isn't allowing them to get the knee straight. Typically there's going to be quad atrophy, which means the quad is not going to be as strong, or it's not going to have the same ability to activate as it would on the other side or in a non-painful knee. So what we're going to start with is the quad set exercise. And what that is, it's very simple but very effective. we're gonna just be in like a long sitting position such as this. If you have tightness in the hamstrings, you could lean back a little bit more. And what you're gonna do is just push the knee down as hard as you can and bring the toes up at the same time. Hold it for about 5 to 10 seconds and then take a rest. While you're focusing on pushing the knee down, you could put like your fingers there just to give you that cue to push down, and even tapping your quads to get them engaged as well, because you want to start getting the quads engaged, because the quads are what helps stabilize the knee and give it that full extended position. 5 to 10 second holds and relax. And I would do this about 2 to 3 times a day to really start to get changes in range of motion in the knee. The next great exercise to do to help straighten out the knee is what's called the seated calf stretch. So when the knee is like this and it's lacking full extension, the muscles in the back of the knee, the hamstrings and the calf, tighten up around the knee, which causes discomfort in the back of the knee and also doesn't allow those muscles to relax and the knee to get straight. So usually I like to use a long towel roll for this, which I wrap right around the foot. You could also use like a dog leash or a strap out strap, but this way it really gets the entire back of the foot. And you're gonna bring it over here and then pull it towards you, and you should feel a nice stretch right in the back of the hamstring, the calf, and the knee. I would typically hold this from anywhere from 30 to 60 seconds, 2 to 3 times. Just a great way to improve range of motion in the knee. The next exercise we're going to do is more functional. So we're actually going to be standing up, and it's called a standing knee extension exercise. So you could hold on to the wall. You're going to have your knee in a bent position, the front knee, and then you're going to push the knee all the way back, hold for about 5 seconds, and then back to neutral. And again, push the knee all the way back using the quad, hold that for about 5 to 10 seconds, and back to neutral. To progress that, if it's a little too easy or you start getting really good at it, you could put a resistance TheraBand back here and then push that knee against the TheraBand. And then push it to really start to engage the quad a lot more. And typically about 2 times a day with that. All right, so now we're ready to move on to the third category of knee pain, which is full range of motion in the knee, but there's just pain. This could be caused by a lot of different things. It could be caused by a meniscal tear. It could be caused by a muscular imbalance between the hip and the knee. Typically, it's due to weakness in the core, hip, and knee area. And so this third category, I'm going to show 2 or 3 exercises as a preview of how to start strengthening the glute areas, because that's one of the best ways to strengthen the knee. So the first beginner exercise to do when you have knee pain, but you have full range of motion, is to strengthen the glutes by the form of a bridge. So you're going to be on your back, squeeze the glute muscles together, and then bridge up. Make sure not to engage your low back, and then back down. So again, squeeze your glutes together first, and then use those muscles to bridge up. Push the weight through your heels, and then back down. Typically 2 to 3 sets of 10 times. One of the best hip strengthening exercises to do is what's called the clamshell exercise. So we're going to come onto the side. Knees should be about 45 degrees. So if this is 90 and this is 0, you want them about neutral. And then what you're going to do is use your hand to stabilize your pelvis, and then bring the knee up and down, up and down. Be careful not to completely rotate out when you lift the knee up, as a lot of people do. Make sure you're really stabilizing this hip, bringing the knee up and down. Great beginner exercise to strengthen this glute area. Now, these 2 exercises were pretty basic just to get the glutes starting to fire. In a couple of weeks, we're actually going to be putting out another video on the 10 best exercises to strengthen your glutes, which will incorporate a lot of different progressions and a lot of strengthening exercises in different positions. But this is a great place to get started if you have knee pain. Hey guys, thanks for watching. Hopefully you're on your pain-free journey after watching this video. Please do hit the like button if you were able to get some value out of this, and definitely subscribe to our channel, as we're going to be posting about 2 videos per week every Sunday and Wednesday. Comment down below, let us know what exercises you liked and didn't like and the reasons, and also if there's any requests that you have for future videos that you'd like us to do.